We were founded by a mother's determination to see a world where no mother, child, or family is devastated by HIV and AIDS. We were the first to advocate for children living with HIV in the US and to blaze the trail in the global fight to end AIDS in children. Today, we know that each stage of life brings new and different challenges. Without appropriate testing, mothers may unknowingly pass HIV to their children. Without support, families may keep their HIV status a secret, making treatment difficult. Adolescents living with HIV face harmful stigma, and adolescent girls and young women are especially vulnerable. But we are leading the charge to end the epidemic for children, youth, and families around the world. We work with communities to increase access to information, services, and support. We provide technical expertise and solutions to support on-the-ground responses. We advance research that finds evidence to drive action. And we advocate on the world stage and at local levels for resources, policies, and leadership. Together, we have made significant progress. But the challenges facing youth and young adults requires a determined, agile response. Each week, around 10,000 youth become infected with HIV, and over 2,000 children die from this disease. For over 30 years, we have been fighting an evolving epidemic. Today, you can be part of the solution. Join us in fighting for an AIDS-free generation.
Hello to everyone tuning in. I'm Jake Glazer, an ambassador for the Elizabeth Glazer Pediatric AIDS Foundation. And on behalf of EGPAF, I would like to welcome you to this panel on perspectives of young people living with HIV. Founded over 30 years ago through the determination of my mother, Elizabeth Glazer, EGPAF is a global leader in the fight for an AIDS-free generation and an advocate for children, youth, and families to live long and healthy lives. We know that in each stage of life, from infancy to adulthood, brings new and different challenges. And today we are highlighting one incredibly crucial time: adolescence. Adolescents and young people around the world are disproportionately impacted by HIV. And if we want to change that, we need their help. Turning towards our session today, it has been such a pleasure getting to know our two panelists. These incredible hearts and minds are our future thought leaders, change makers, and trailblazers. And my friends, Dee and Brian. Over the past few years, we have learned so much from each other around youth advocacy and how to change the paradigm into the future. I could not be more excited that each of you get to witness their passion and hear about their experiences, so that we can better understand the challenges and opportunities around youth HIV programming, and specifically from their perspective. I am also extremely excited that Brian and I will also be continuing this dialogue on EGPAF's Facebook page, so I invite you to join us after this session and keep the conversation going. We will talk about life experience, our challenges and accomplishments, and some creative ideas on how we can physically change the healthcare experience for youth. Create a lifestyle that speaks to their passions, as well as a unique perspective on the new normalized landscape of digital connectivity and how youth are leveraging platforms like WhatsApp and others to grow some of the most connected support groups across Africa. And now, I am extremely happy to introduce EGPAF's Lesotho Technical Director and our moderator, Esther Tumbare, who will facilitate today's discussion. Thank you.
Good morning, good afternoon, good evening to everyone around the world. I'm Esther Tumbare, Technical Director for EGPAF Lesotho. I'm so pleased to be here today as we are proud of the work EGPAF has done to learn from young people living with HIV themselves. Each day, they provide essential guidance to EGPAF about their own needs and preferences, showing us how best to reach and effectively serve young people. Adolescents and young people represent the key to ending the HIV epidemic, as well as an opportunity to address the existing sexual and reproductive health needs of every generation. While youth are an especially important group, They are often underserved in clinics. As we all know, the period of adolescence is associated with significant sexual, reproductive, cognitive, and psychological changes. It coincides with the onset of behaviors that continue into adulthood, including risk assessment, sexual debut, and engagement in healthcare. Around the world, progress toward ending the epidemic is improving in nearly all populations except adolescents 10 to 19 years of age. Global leaders have prioritized adolescents and young people as a critical population on which to focus their efforts in order to make the vision of an AIDS-free generation a reality. Steady improvement in HIV testing and diagnosis and expanding access to treatment services have cut the annual number of AIDS-related deaths by 56% worldwide since the virus mortality peaked in 2004. But how exactly do we prioritize youth? It is clear that the path to success begins with listening to young people directly. Today, we have with us two inspirational advocates who will share with us their unique perspectives as young people living with HIV and navigating the various challenges and opportunities that arise. First, we have Dim Puffy, a peer counselor and leader for the Elizabeth Glaser Pediatric AIDS Foundation in Lesotho. In this role, she empowers adolescents to access health services and develop life skills so that they can stay healthy and strong. We are also pleased to have Brian Ahimbusizwe, an EGPAF ambassador, Global Health Corps Fellow, and student pursuing his Masters of Public Health at Mbarara University of Science and Technology. As an advocate for young people living with HIV, Brian uses his story to normalize HIV and work to end stigma. For our panel today, I'm going to pose some questions that serve to help drive a dialogue and accomplish our task today, which is to hear from both of you directly. I'll start with you, Brian, and just to hear your thoughts on what you think are the most important things youth need when it comes to preventing HIV, and what do you think doesn't really work?
Thank you, Esther. My name is Brian, like you had introduced me. And to answer your question, I think all that the youth need, youth-tailored services. Like we've always sung it in conferences, the youth need services that are broken down to their needs, that pull their interests. If a young person walked into a clinic, what would be catchy for me as a young person to want to come to the clinic the next day? Or what are those turn-offs that don't want me to be in the clinic another time? For example, we get to see services that are rhetoric. The old people or the young people all accessing services at once, which in a way doesn't give the youth a safe space or an opportunity to share their ideas or bring out what they thought their services could be. But then also most of these interventions that aimed for the youth do not initially involve the youth in their planning. The youth are always called in the implementation process, and they are implementing or being recipients to interventions or services they did not participate in their design, but getting the youth to the same table with the policymakers and the global leaders to discuss on what they think the youth want is more appealing. I mean, what I wanted when I was young is not the same that I want now. But then the mentality is still clogged to think that what appealed to me as a young person is the same that's appealing to the young people. For example, we were having a lot of psychosocial issues in Uganda. And there were psychosocial interventions going on in clinics. I mean, we had counselors, we had peer educators, we had all psychosocial officers. But then we would see people failing, young people failing on treatment. And we wondered why. Not until we opened this Area Superstars psychosocial support WhatsApp group that become a nice breaker for young people. Young people tell us their daily experience at the clinic and say, oh, today I was at the clinic, this nurse is not nice to me. Has any one of you had the same experience? And by the way, I chose not to tell her this and this because she's not nice. But because it was intentional, we would use that to get the information that is underlying with the youth, and also provide the right information that they need. And so every day there's something new that's coming in. Someone will post about the new beautiful girl that they met and is wondering how they can talk to them or disclose or approach them. And people give ideas. All ideas are right, and we have a professional that is going to give us the more right information. So such interventions and many more other interventions, like the soccer games that are intentional, the edutainment, where youth come not basically for HIV information that you talk about every day. They learn it from school, they see it on TV, they read it in newspapers. So they assume there's nothing new. So all the new that they need is that one thing that's catchy for them as a young person. What do I want to see? What do I want to hear? And how is it packaged for me? To me, that's key in having the youth at the forefront of prevention and ending the HIV problem.
Interesting. Thank you, Brian. And Dee, what do you think makes youth so different from adults when it comes to their experiences living with HIV, both in the clinical setting as well as in the community?
Thank you, Dr. Esther, for that. My name is Dee, like you mentioned before. What makes youth different from adults is that youth are very vulnerable and sensitive when it comes to health issues in general. And especially with HIV, we have adults in our community who have a different perspective on how HIV is transmitted. And especially when it comes to young people, they have this myth that HIV is only transmitted via sexual intercourse, which is not always the case for young people. So if you're a young person and you live in a community and someone is already pointing fingers at you and specifying that you aren't behaving well, this is why you are HIV positive, then it's going to be very difficult for that young person to accept their statuses and take their medication. And then when you get to the facility, you need to have the support that you don't have in the community, because you have a perspective as a young person that people in the health facility who are health providers actually know better than the people in the community. But you tend to get people who are more intended to lecture us, who are more intended to be our parents than our health providers. And then they judge you from the perspective of being a parent and not give us the services that we need in a comfort that we need. So it's a bit difficult for young people to accept their statuses and take their medication well and suppress their viral loads. So if we only change the perspective of how the community takes HIV, and then we'll have young people who are able to be free enough because they spend most of the time in the community than in the health facility. So if we have the support system from the community by the adults who we take as our parents, then we'll be able to take the HIV very easy and accept our statuses. Thank you.
Thanks, Dee. And as a young person living openly with HIV yourself, what has been your personal experiences with the clinics?
Like I mentioned before, that we have health providers who judge us rather than to support us, as we know that they are more informed or have more information on HIV. I was discriminated and stigmatized by a doctor when I was initiated back in 2016, which was kind of a shock to me because I was expecting this person to be more supportive, this person to give me more information on HIV than any other person out there. But it turned out to not be so good until I got the transfer to the adolescent corner, which I get services from other young people to young people like me, and then I'm able to be free. I'm able to build a relationship with them, a rapport with them, because we connect properly with these people because we are at the same age. So we are able to share any challenges that we come across as people living with HIV. You're able to be free. You're able to tell that really I was not able to take my medication because this happened, or I took my medication overdose because this happened. So we are able to connect, and they're able to understand the problems that we come across as young people living with HIV. Hence, we need to have more adolescent youth-friendly services in most of the facilities, because we have young people who HIV is still such an issue to them, and they aren't able to accept their statuses. Thank you.
Yeah, we know about the youth corners in Lesotho that are doing excellent work. Brian, what challenges or stigma have you faced with your family or peers or within the community where you live?
They've not been a Brian challenge. Growing up, I've realized everyone was going through these same challenges with school, at home, even the facility themselves, like Dee said, but they all stem from the stigma, which stigma is from the lack of information, I can say, even when there's so much information about HIV, but people failing to realize that it is not a big deal anymore. The other day we had a meeting with one of the leaders, one of the elders, and they were saying the problem with HIV is that young people don't take it serious anymore. And I was telling him the only way for you to get on the message and people accept their status and start treatment and take care of themselves and make sure they know that they cannot pass it on is by making it okay. Don't criminalize it like it used to be in your times for people to take it in, for it to cause change. Times have moved on, and what used to be the most appealing social behavior change message in the 90s is not the same message that is carried on today. So these challenges are every day, but they all stem from stigma and lack of information.
Thanks, Brian. And talking about living a healthy life with HIV, Dee, congratulations. We know you're expecting your first child. How has living with HIV influenced your perspective on pregnancy and motherhood in general?
Well, thank you very much for congratulating me. It's very exciting to be pregnant and have a family. Well, I'm HIV positive. It shows that really I'm as normal, if I may say, like any other person. With the undetectable viral load, I have a negative husband and hoping for a negative baby in August. But really, it has been a very normal life like anyone else. As I take my medication every day, one pill every day, it's not such a big deal. But I think it's a chance for other young people to see that really we aren't just preaching that living with HIV, it's nothing, but really you can still have a family, you can still have a future, you can still have anything that you want as a young person, as long as you take your medication and keep your viral load suppressed. Thank you.
Yeah, excellent. We are very happy for you, Dee, and we wish you and your family well. Brian, you talked before about modernizing the HIV response. What do you think how do you think youth can be involved in this process of to modernize the HIV response for this generation?
One, thanks to EGPAF for platforms like this. Youth voices can be heard. I mean, you're a technical director. I'm a service recipient. Where else would we find the same platform where I can talk to you? Initially, a doctor was a demigod. Like, what you tell me is what I have to take. You don't have to hear what my mind feels or what how I would want my services to be. but modernizing it goes even beyond that. Like, like with our WhatsApp Psychosocial Club in Uganda, it is modern because it is a free space. It is a safe space. I can say anything on the group without my face being seen, without feeling shy of being judged or asked why I'm having sex or I intend to have sex, or very many things happen when these interventions are modernized. Like the intro says, I am an advocate to normalizing HIV. The other day, a young person, 11 years old, had psychosocial issues. They've not talked to anyone about what they are going through. All they know is when I get to the clinic, they'll ask me how many pills I have, if I'm taking my medication well. And so they are on autoplay for answers. They know the answers to give you, doctors. But then their viral load is going up every other day and people are wondering why. Not until we get into a soccer game and we make a bet. If you score a goal, you say your secret. And it didn't take me even 10 minutes to score a goal. And I got to know everything, what this young person was going through. They're being harassed at school. They are not staying with their parents, and the family that they are staying with is not conducive. There's someone at the clinic that they don't like, so why should they even come anyway to the clinic? So some of those very many interventions, embracing technology to pass on these messages, just a simple text message to a group of young people as a reminder to take their medicine or to visit the clinic is enough than you coming home with your bags and the whole clinic saying you're following me up. So modernizing these interventions will be key in appealing to the youth, because youth want modern things. I mean, want cool things, want things that are trending. So to me, that's key in preventing HIV.
Excellent. So let's use the language that the youth understand. You both have done amazing work in your own capacities in your countries, but we are seeing there's still a rising infection rates amongst youth in some regions of the US and in Africa. What do you think is going on there, and what are we not getting right?
I'll go first. I think, like Brian has mentioned before, that we need to normalize HIV and be okay with it. But at the same time, having that normalizing HIV and being okay with it has a disadvantage as well, because we have young people not even who are more ignorant that HIV is still a serious pandemic that we have, who are very ignorant in terms of prevention or preventive measures that we have for HIV. We have young people not using condoms. We have young people not taking PrEP, and it's really hard for them to take PrEP in our side in Lesotho. So we still need to give them more information on preventive measures so that we tend to decrease the new infections that we have. And also, there's one thing that is so common that we have from young people. It's called cyberbullying. We have other young people stigmatizing other young people on social media who are living with HIV. So the modern thing also has a disadvantage in a way, because now that we are talking about HIV, we are normalizing it, but people still stigmatize and discriminate other young people who are even saying, now we want to share our stories and be open, live openly with HIV, and help other young people, to motivate them in a way to get tested and take their medication. But at the same time, we still have other young people who are stigmatizing us. So we still need to strengthen how we give information to young people in a way that they would understand better and stop discriminating other young people. Thank you.
Thank you. And as we conclude this discussion, Brian, is there one thing experts listening to this session should know or do when engaging with youth affected by HIV?
The one magic bullet that I've seen through personal experience, through my work now that I'm a professional, is get young people on the same table with you. You might not take everything that they will tell you as a plus or minus, but get to hear from them. From the 10 or 50 words, they will say, at least you would have an idea of what it feels. You will agree with me that the things that worked for you when you were my age are not the same things that work for you now. So we need that everyday revampment or overhaul of getting these young people on the same table to get into the designing of the policies. They don't have to be professional. They are recipients of the services that you're going to give. So that's key for them, because if they are into it, the interventions will be a success. If they are not, no matter how much investment and science we put, they still won't be able to take on the services.
Excellent. That nicely, summarizes our discussion. Nothing for youth without youth again. Thanks to all of our participants, Dee and Brian, and viewers for joining us. This conversation today is part of EGPAF's broader focus on lifting up the voices of young people. To continue prioritizing and facilitating meaningful youth participation across our projects, EGPAF is releasing a report entitled AIDS-Free Generation Z, a call to action for improving youth-focused HIV programming, which includes results from a survey of young people around the world and the inspirational ways they are leading the fight for an AIDS-free generation in their communities globally. The full report can be found on our website, pedaids.org. And now, please enjoy this short video.
It is important to engage young leaders in programs designing for adolescents and young people.
So I think political leaders could help by ensuring that they include adolescents and youth in decision making, especially on those decisions that have or will have an impact on the youth themselves.
There is need of meaningful youth engagement at all available platforms, from planning to implementation, so that we ensure adolescents and young people raise their voices, so that strategies and policies addressing structural barriers in limiting access to quality services.
The civil society could help by decentralizing their services to remote areas or rural areas, so that they are easily accessible to every HIV positive adolescent and youth.
Implementers or donors should have a specific budget that directly supports marginalized groups, so that we ensure quality service provision for all sectors.
Advocates could help by advocating for removal of legal barriers and policies that hinder accessibility to quality HIV care.
Are often represented with a strong sense of credibility and knowledge, and are therefore able to show others how to remain confident to access, realize, and actualize their full potential, even in different situations that they undergo in life.
Okay, I'm going to go ahead. You guys did a great job already, and I just have the privilege of joining you for some live question and answers. We've already gotten a couple, so I'm just going to start right in. My name is Chip Lyons, the President and CEO of EGPAF. I can't resist. Dee, congratulations. I hadn't heard your wonderful news. That's very, very exciting. The first question to either of you, I think, Brian, you mentioned a little bit more about WhatsApp, but the question is, with the WhatsApp groups, when you're hearing these issues about providers that are not supportive, is there an avenue through which you can bring this information to the facilities so that the providers can be aware of how their actions are impacting their clients? Great question. What's your reaction to that?
Thank you, Chip. So what we decided to do with the WhatsApp groups, we intentionally added a few old service providers, like for each facility of where these young people get their services, there is their favorite clinician or doctor that they all agreed and confide in. So we intentionally add them so that some of these underlying issues that come up every day can be addressed to them. Also, we've had informal working groups with these service providers, with the doctors. We've tried to bridge that generational or professional gap, where we indirectly bring up these issues to them in a joking way, not to sound disrespectful, so that they know that, yeah, this is the feedback. So we leverage the WhatsApp groups to be like a suggestion box or a feedback avenue for both the service providers and the recipients of the service.
Great, thanks, Brian. Dee, do you have experience of trying to give feedback to a healthcare worker that is being less than supportive, to put it mildly? Have you gotten some results figuring out a way to give that sort of feedback? Do you realize the effect when you're treating someone a certain way? Do you have any advice? I'm not sure if we still have Dee on the line. Maybe.
Hello.
Dee, are you there? Terrific. There. Did you get the question?
Yeah, I did. Thank you. Can you hear me now?
Yep. Please go ahead.
Okay. We do get feedback from other clients, although some of them don't really give feedback. We just see them transferring out, but self-transferring, because they don't usually come to us and tell us that they'll be going somewhere else, because most of the time when people want to transfer, would usually ask questions that why do they want to transfer? Is it because it's more convenient for them to be there, or anything? So because young people could be shy to tell you that you give them bad services, they would never even tell us. Even the suggestion box that we have, we find less comments from them, from the facilities. So it's a bit difficult to get. But when they like Brian had said, when they love someone, they really confide it to them, and they could even WhatsApp you even in the midnight and tell you their problems or ask you any questions they have if they do.
Thanks, Dee. I want to come back to you and bring in Esther. I have another question from a listener or a participant. What's the current status in Lesotho regarding access, uptake, and adherence? Can we really say that we will win this fight, taking into consideration the fact that the infections are rising instead of decreasing? Esther, do you want to go first on that? Yeah, jump in.
Sure, thanks, Chip. Access to treatment for adolescents in Lesotho is quite good. In addition to provision of HIV testing, at initiation, integrated HIV and TB services at all health facilities, we do have also, in addition, established quite a few adolescent-friendly corners, which are dedicated to provision of adolescent-friendly services to young people from age 10 to age 24. So in the past maybe 2 to 3 years, we've seen an increase, a huge increase in the number of young people who are coming in to access services. Although of course we still do see a lot more girls compared to boys coming in. And as far as linkage to treatment, because of the establishment of these friendly services, we've seen quite a huge increase, reaching about 100%, even over 100% of those testing positive actually being linked to ART. And as people might know, Lesotho has some of the biggest access to actual viral load testing in the country. Our coverage currently stands at about 86%. And in terms of viral load suppression rates, even though our adolescents do lag behind the older populations, we have commendable suppression rates, probably over 80% amongst our young people. So I think this fight can be won as long as, again, we continue to involve the young people as we provide services. Thank you.
Thanks, Esther. Brian, I want to, I'm going to pull parts of the question from a participant named Winnie. Thank you, Winnie. Very much appreciates the session and your comments in the previous discussion. Wondering about access for adolescents who don't have mobile phones, for example, or is it your experience that the vast majority of friends and others that you know, if someone is challenged in terms of regular access to mobile phone, how can you still work in terms of peer counseling or get them information? Have you run into that as a problem, or do you find mobile phones are pretty ubiquitous? Brian?
I'm happy to know that Auntie Winnie is tapping our session. That's exciting. She's a role model to many of us here in Uganda, and we love her so much. What we did before evolving into a WhatsApp group, we didn't know that we were doing follow-ups and home-based care in the professional language. I would pass by my friend's home and get to know how they are doing, or if we met at the clinic and I didn't see them on a particular weekend, out of friendship and courtesy, would just pass by their home and get to know how they're doing and get to know why they didn't come to the clinic. Little did we know that this was a customized service that we were offering to each other, like peer-to-peer led. So it is the same thing that we are doing right now. Most of our members have participated, actually national trainers of trainers for the YAPS model in Uganda. And what we've tried to do is to make sure it's so inclusive, even those without mobile phones. We get to their homes. We attach peers that are the clinic to do personal follow-ups at home. Because for each member of the WhatsApp group, they represent a wider community of young people at that clinic. So some of the information that we discuss, or if there is need, or if someone is lost at a clinic, or if we've not heard from them in a while, we take it upon ourselves. I know many experiences where we've requested EGPAF to support us with transport to get to these people's homes and know how they are doing.
Brian, thank you. Very interesting question. I know we're short on time, so both to Dee and to Brian, try and do a 1 or 2 sentence answer to this. What is your view on trying to make the entire health facility youth-friendly rather than having specific youth-friendly corners? It seems that your preference is for specific corners. Can you explain why?
I'll go first. I think it's very important because young people get really intimidated from when they get through the main gate of the facility. This is why EGPAF Lesotho basically trained from the security person at the gate to the person who cleans the facility. They train them on youth-friendly health services, because every young person came to the facility and they're already being discriminated or talked badly by a person who is not even at the adolescent corner, then that person is not going to be comfortable at all throughout the session. So it's very important that everyone in the facility are trained on youth-friendly health services, because you may find that sometimes we need something from the OPD, which is where all the patients are seen or all the people are seen, and you have to refer a young person to that facility. Then they find bad services that says we did not do anything at all. That person is not going to come back to our facility. So it's very important that we have that.
Dedicated corners. Brian, your view, 1 minute or less?
Initially, I was in support of the youth-friendly corners until I got a personal experience where the clinic thought I had outgrown the youth corners, and I still wanted to keep in the youth corners, which is an experience for many young people. So now I am in for integration, getting each service everywhere, youth tailored, regardless of the OPD, of the gate, anywhere else. Because at times with the youth corners, we have young people who've been adhering well because they got services from the youth corners, and when they graduate to the general clinic, they start falling back because the services have not been the same. So I'm in for integration, getting services tailored to the youth regardless of where.
Thanks, Brian. I think I got my timing wrong. It seems we have a little more time, which is great because we certainly have more questions. So I assume the host will flag me down when I need to wind it up. It's a related question. I'll put it out also. And Esther, you may know how this has been approached sort of systematically, but the question is, it comes with a comment and a question. It's a shame that discrimination from healthcare providers remains a significant barrier for youth accessing care. Is there a more systematic sensitization training needed for healthcare providers who are working with youth? Who should be responsible for developing and implementing such a training? Esther, do you want to comment on whether you how you approach that systematically in Lesotho? And then Brian and Dee, if you want to add to what Esther has to say.
Yeah, we've tried to incorporate the training of people that we recruit who are going to be working with our patients right at the point of initiation into the EGPAF program, so that they are able to provide friendly services. And going back to the question about the corners, I mean, when we interviewed, when we did focus group discussions with young people, they actually preferred to be served by other young people in a place that was on their own, because they felt like when they go to the public place where everybody else is, they might see people who might be more judgmental. They might be served by older nurses who might be, related, or who might be friends with their moms, and they would not be free to talk about issues that affect them. So we're really trying to incorporate institutionalizing the provision of friendly services right from the start. Thank you.
Brian or Dee, any comment?
No comment. Maz, that's said it.
Yes, for me, my take about it is getting the youth at the forefront. To me, that's what I've already said, and that remains key for me. We've had youth trainings that are led by old people. Yet the young people that could be equipped with the same information, and they can carry it on not only to young people, but to the service providers as well. So that's a nice breaker for whoever service provider is going to attend the session, to know that, so within the recipients of the program or the service that I'm going to offer the next day or the next weeks from now, they will be empowered young people like this who will change my mind. It might not be professionally, but socially, and that is important in getting them to talk and opening up to issues that affect them.
Brian, I want to pick up on what you just said about empowering young people, and it's essentially a question that has come also with a comment. Both Dee and Brian, you both have extensive experience translating the power of meaningful youth engagement into concrete action to that directly impacts lives. What's your advice if there are participants, young people listening in on this conversation? What's your advice to other young advocates and leaders, those that want to lead, want to engage in their communities, seeking to create change in their communities? What's your advice to them about either how to get started or how to stay strong and stay focused and be effective? Your advice to other young people, please.
If I go first, I would say to them, as young people, we need to know what we want before we say we need to be heard, because no one can hear you when you don't know what you want. And then, and then secondly,
I hear you, Dee.
Yeah. Yeah. And then secondly, we need to be firm in terms of we would get so many negative reactions from other people outside or even other leaders who are older than we are, having to discourage us and maybe even questioning what we know as young people because they've been in the field for a very long time. But at the end of the day, these things that are being done or decisions that are being made for us as young people, and we are the people who are going to receive them. So at the end of the day, we need to tell what we want to do. So they should not be discouraged by any negative comments and stay firm, because they know that what they are doing, they're not only doing for themselves, but for everyone else their age.
Well, and you don't need this advice from me, but nobody knows what you need better than you do. I don't care the age or so on. And you have that self-confidence. It's quite clear. I think it's important to try and build up that self-confidence in other folks. You are an expert, both through lived experience. And so that's crucially important, and that needs to be heard. But anyway, you already knew all that. Brian, your comments, please.
My take on that would be to offer yourself for service. When we started very many years ago, we started at the clinic and we didn't know what we were doing was professional. I mean, if we met for an aerial psychosocial club meeting and I realized that my sister D or my friend who is part of the meeting has not come, at the end of the day, I would pass by their home and know what's going on. Or at times I would tap a doctor's talk and they're wondering about a certain child, and I would not even interrupt the talk. I would only take it upon myself to go to that person because they are my friends. We live in the same community. Maybe I pass by their home every day. So I would take it upon myself, ask them what's going on. And then on my next clinic appointment, I'll be like, hey, Chip, you remember the other boy or girl you talked about? I realized they're having issues at home. Or maybe they were stigmatized at school, so they don't feel the need to come. So through that, through offering yourself for service, people will appreciate your service in the long run. And yeah, they'll offer you opportunities for a few trainings to polish you up. And yes, who knows, the next time you're a change maker at your community, and it goes on like that.
I think, Brian, what you're offering besides service, in addition to service, is empathy. And that goes a long way in connecting with folks. If somebody's paying attention to them, someone cares if they're having issues and trying to figure out a way to support them. I think that's great advice, and you have a great manner about you in how you would do that. There's another question here, and the questioner may not have heard comments from the previous panel, because the question is, are you using technology to keep in contact with youth? And the WhatsApp groups are a very good example of that. But I want to ask the question anyway, in case there are other examples. Any of you, Esther, Dee, or Brian, want to comment. How do you apply technology to keep youth connected? WhatsApp is an obvious good example. Are there other techniques you're using?
I can Go ahead, Dee.
Okay, thank you. We have also a Facebook page that we post different posts on it so that young people keep connected and get information as much as they could. Although it's a bit tricky because young people still need something that is more vibrant, something that is less technical. So yeah, that's what we have.
Esther, you were going to say?
I was going to say at two of our centers, we also have put in some laptops with Wi-Fi so that some of our young people that want to come in, to attract those young people to come in for services, they can still use the laptops in those centers. Sometimes we also have call-in radio shows where they can call in and ask questions. A lot of them are also on Twitter, and Dee talked about Facebook. So it's very much a techno world at the moment.
Yep. Brian, anything to add? You already commented really nicely on WhatsApp stuff. Go ahead.
Most recently, one of our members at the Aerial Superstars WhatsApp group realized that, we were not reaching all the youth, since some of them are not on WhatsApp. So she introduced the text messaging. So we look out at the facility, those particular members that are not suppressed or are having issues with their adherence. And so we have a list and the time of their medication. So we send reminder text messages to let them know it's time for the game. We make it so youth tailored that even if someone else read your text message, they wouldn't know that the reminder is for your medication, but the one who the message is directed to understands every time they receive a text message from us. Then, like Esther said, we also do radio talk shows, intentional radio talk shows where we request to be hosted, and talk about being free with their status or adherence, or where they can find support if someone is in the community and has not accessed services.
Thanks, Brian. One more question. We're down to just a couple minutes, and this time I think I do have the timing correct. And it's to all three of you, please. The question is, statement in question, ending stigma and helping to reduce infection rates among youth will likely require the commitment of many different stakeholders, from policymakers and donors to researchers and frontline health workers. Do you have a single message that you would send to these decision makers in order to catalyze change? Who wants to go first?
I can go first, Chip. And I guess if I'm confined to one message, I can say they should listen to the youth. But if I was allowed a second message, I would say there should be more collaborative efforts, because a lot of them are working in silos to address the same problem. And they should be better integrated and work together in addressing youth problems. Thank you.
And I'll go after.
Go ahead, Dee.
Because it's a follow-up from what Dr. Esther said. With collaboration with young people, it shouldn't just be a meeting with young people, but whatever that they say on the table should be taken into consideration, not just to be there and sign a consent that we had young people at the age of 15 to 24, they had their inputs, but the inputs were not even put into consideration or even implemented.
Thank you, Dee. Brian?
Mine would be to create a generational follow-on of young leaders. 10 years from now or 20, I won't be young anymore. So what I do today might not be relevant then. But like we've done with the WhatsApp, with the psychosocial WhatsApp groups, with the young folks like Hajara, like Peter, that are evolving, we are trying to make it generational so that whatever generation comes in has someone that has sprouted out to be appealing to them.
Thanks, Brian. I think we still have another minute. We have a question from San Francisco. We too have a problem creating a bridge from youth clinics and services to adult clinics and services. What other ways can we, what other things can we do to serve these youth communities and make a bridge to transition to adult services? I know you manage that, Esther, in Lesotho at the youth corners that I've visited with you. Can you comment on that? And then likewise, Dee and Brian, if they have advice. It's a bridging between the two. There's a transition and making them connect and be effective together. Do you have any thoughts on that?
Yes, thanks, Chip. What we actually do is start to introduce adult care way before the time when the youth has to be transitioned to adult care. So we start talking about the fact that, you know, they're going to have to be transitioned to an adult care clinic, perhaps 2 or 3 years before it's done, so that it's a gradual process, and we are preparing them for this care. Otherwise, if it's done abruptly, then they're going to default and they're going to be miserable because they'll still want to continue at the age of, say, 25 when they're supposed to be now in adult care. Thank you.
Thank you, Esther.
And then after doing that, we also invite these people serving the adults to the adolescent corner to see how we treat these young people, and also for the young people to be familiar with the faces and how the adult corners work.
Thank you, Dee. Brian, if you've got just a couple words, I'm going to have to wind this up because there's another session right on the hour here.
Oh yeah, mine, like I said before, is integrating the youth services to all key service points. There won't have issues of any bridge because at every service point, you will find a youth tailored service, which is even okay for continuity, since most of these youth corners are supported by projects that have timelines, and then when they're no more, the service is gradually ended. So if everywhere at the clinics, all key service points have youth tailored services, then there would be no bridge between the youth clinic and the adult clinic.
Thank you, Brian. I want to thank everyone that has participated, listened, asked questions, particularly Esther, Dee, and Brian. You guys are doing such good work in Uganda and Lesotho specifically, but I know you inspire people outside of your own countries. The sort of bottom line is young people need to be at the table, but they need to be at the multiple tables, the planning table, not just the launch table, not just the evaluation table, but from the beginning, I think comes through loud and clear. To anyone that wants to learn more about EGPAF's priorities, not just around pediatrics, but also for the health and well-being of young people and families, reducing new infections, prevention strategies, and so on, please don't hesitate to visit pedaids.org/AIDS-free Generation Z. But you can find us, Google us, EGPAF, Elizabeth Glaser Pediatric AIDS Foundation. Thank you all very much for joining us, and thank you to the panelists. You did a terrific job.